25 minutes before 11 o'clock. Thank you for tuning in. I have no way of knowing what clinical depression feels like. I have a way of knowing what being sad feels like. I mean, I've had my days, but I really don't think, and this is really a blessing, I guess, that I'm expressing here to you, that I've never actually gone through clinical depression. And I don't even, I've known people who have, though. And of course, there are some famous names we could mention who we were told had clinical depression. But anyway, let's talk about this for a little bit. And how effective is therapy? How effective is it to go to see somebody? And you know, the whole couch thing, they always talk about that, laying on the couch.
Yeah.
I mean, it may not be a couch. You know, and just to speak of my own, I don't know if it's not clinical, if it's just like feeling sad, like somebody's died or somebody's moved away or something like that. Those kind of depressions that I've gone through. I mean, I had two ways of dealing with it. One was either to just dive into the sad feeling, put the sad songs on, look at the old pictures, you know, until I got sick and tired of the old sad songs and the, you know,
Yeah, right,
you dive into it to the point where you overdose on it, and then you say, okay, I'm done. Now I'm ready to live life again. Or you do the opposite. You watch some silly movie, or you read a funny book or something like that.
Yeah.
Or you hang out with kids. You know, kids are running around all over the place. I remember that experience one time. I went to a funeral. It was my mom's funeral, I think.
Yes.
And I was really sad. But there in that room, or the grandchildren, just little children, just running around.
I know.
You can't help but be affected by that. But of course, that, again, is not clinical or chronic depression. Dr. Thelma Duffey is on the phone in Orlando, correct, Robin?
Yes.
She is a licensed professional counselor and the president-elect of the American Counseling Association. She's going to talk to us about the value that counseling can bring to a person suffering from depression or other forms of mental concern like anxiety or stress. And let's find out about this from Dr. Duffey. Good morning, doctor.
Good morning.
How are you?
I'm great. It's good to be here in Orlando.
Yeah, where do you live? Where's home?
I live in San Antonio, Texas.
Oh, wow. So, well, thank you for coming here. Not too much of a difference in climates, I wouldn't think. Maybe more humid here.
Actually, very recently, we've had a really cold spell, and Orlando's feeling absolutely wonderful. So we're all delighted.
So, you're in Orlando. Could I shake the depression if I went to Disneyland, Disney World?
I don't know if you can shake depression, but I think going to Disneyland is certainly good for your mental health.
So I was trying to differentiate between whatever I've experienced and somebody who's had clinical depression. Talk to me about the differences regarding a therapist. I mean, is it even necessary for the normal, like sadness after somebody dies? Do I even need a therapist for that?
So, actually, as counselors, as professional counselors, we work with people facing all sorts of issues, and I do a lot of grief work, and a lot of my work in my practice is working with people who undergo losses, such as the death of a loved one, or the loss of a job, or just any change, any unexpected or even anticipated change. So counselors can be very helpful in helping people reflect on and move forward during difficult times. So yes, I definitely would say that counseling can be very helpful.
And as far as somebody who's clinically depressed, do you agree with the method of using medications?
So there are many ways that clinical depression needs to be diagnosed, and certainly you go to a counselor, but you also go to a medical doctor, and a medical doctor would be the one to make that determination on whether medication is the preferred method. There certainly are many adjunct methods of supporting people who have depression. And a lot of times people will collaborate. There'll be treatment teams. There might be a medical doctor and a professional counselor. If it's involving a child, it could be the school counselor as well. So a team effort is always a good way to go.
You are at the American Counseling Association conference in Orlando right now. What similarities do counselors have on a certain issue throughout the country? Is there one issue that pops to the top?
In terms of people's issues,
Yes.
or like what issues do people have throughout the country? Is that
Right. Is there like one topic that there are people that the different counselors treat that really worries them the most?
Well, that's a really good question. I don't think that I would say that there is one top issue, but definitely in this day and age, with so much information about the difficulties that go around the world, and with families undergoing different losses, and even the military, and I live in San Antonio, which is a military community. I think adjusting to very difficult situations and trying to ward off that depression that you talked about earlier is obviously something that counselors are very concerned about and want to help people work through.
So does the therapy that you recommend for a patient ever include a loved one? Let's say a man comes in with his wife, and it's his wife who needs the help. So she goes in and sits with you and has her therapy. Do you ever go out to him and say, look, you know what you need to do? You need to take her out to dinner and now and then. I mean, does that ever happen where you actually tell a loved one, here's a way to help out your loved one, go take them?
Actually, absolutely. One of the things that we do I do in my counseling practice is when I look at one person's issue or problem within the context of the people around them as well. So if it's one person's issue in a relationship, it's everybody's issue, of course. So I do like working with different members of the family and finding ways that they can support one another, and ways that the date night is something that we talked about just last week with a couple of clients that I've worked with, that I'm working with.
Yeah, I would think
So
so.
yes, that's absolutely something that is helpful.
What about a child, like a child, a school-age child who is being bullied, and he's really, really distraught because of this stupid bullying that's going on in his school? What do you say to that child to help him? I mean, the bullying may never stop, but maybe you can teach the child how to deal with it better.
Well, actually, that's a really good point, and that's actually one of my key initiatives for next year, is looking at bullying across the lifespan, because I think bullying happens to people of all ages. We hear about it with children an awful lot, but we can certainly see it in homes, and we can see it in workplaces. We can see it with our older adults. So with anybody who is facing bullying, and particularly, as you say, a child, I think one of the things I would encourage is to help them talk about it. If you see somebody withdrawn and not speaking or acting out of character, or appearing to be lost or lonely, invite the conversation, because sometimes just knowing they're not alone and that somebody cares is a really important part of feeling better.
Yeah.
So definitely that. And in terms of just specific words to say, I wouldn't want to get trite on that. Wouldn't want to say, oh, it gets better, because we don't know that. But I think just knowing that people aren't alone, and that you care, and then if there's any kind of advocacy that we can do on behalf of the person who's being bullied, I think that's important too. Empowerment and advocacy are both very important in helping people facing a bullying situation.
Doctor, thank you for being on the air with us. Enjoy Orlando. It's a fun town.
Yes.
And have a safe trip back. And before we say goodbye, do you want to give us a website that our listeners can visit?
Sure, absolutely. Thank you again. We're at www.counseling.org.
Okay, that's easy enough.
And so happy to have ACA here in Orlando, and thanks for the great weather.
Oh, you're welcome. It was my pleasure.
I'm glad y'all arranged that for us.
Well, that was fun. A fun way to end it. All right, we'll take a break. We'll be right back.
Career Source, Citrus, Levy, Marion brings together business and community partners, economic development leaders, and educational providers to connect employers with qualified, skilled talent and job seekers with employment and career development opportunities. Tune in the first and third